So hello, and thank you for joining us, and welcome to the National Adaptation Forum's Heat Stress Series, hosted by EcoAdapt. I'm Molly Johnson, one of the forum organizers, and your organizer for today's webinar, Rural Heat Challenges and Interventions. For those of you who are returning to the series, welcome back. And for those who are just joining us, I'd like to go through some housekeeping rules to ensure a successful webinar. To help us reduce feedback, please place your telephone, cell phone, or computer on mute, even if you are using the microphone voice over IP option. And please use the question function on your control panel to submit any questions to the presenters throughout the webinar. Please also use the question function to report any technical issues, and my colleague Catherine will be assisting you. We will be recording and posting this webinar on the Climate Adaptation Knowledge Exchange for future viewing, and the webinar should be available online next week and can be viewed at cakex.org. Slides and presenter information are available for download in your Handouts tab. You can find that in your control panel. And throughout the series, we will be compiling recommended resources on heat stress for attendees and the larger adaptation community. So you can make suggestions to that resource page by following the link that my colleague Catherine will put in the chat box. Finally, we want to thank those who have donated to the forum to make this series possible. And if you haven't already, please consider making a gift of $20 per session and $60 per series, or paying what you can. If your organization is interested in sponsoring the upcoming series, you can contact us at info@nationaladaptationforum.org. And your support makes sessions like these possible and helps us to keep adaptation moving forward. Before we begin, I would also like to acknowledge that there are many people experiencing immediate threats to their lives and livelihoods due to climate change impacts, including the most recent disasters and tragedies that occurred due to the extreme cold polar vortex. I want to recognize those who live on the front lines of climate change, especially Black, Brown, and Indigenous communities and low-income communities. While we are here today to talk about heat stress, I encourage you to share about your work, your experiences, and what brings you to this session via the questions function, as well as on our virtual networking platforms. And I also want to thank you for attending today, despite all of the challenges and uncertainty due to the ongoing pandemic. So with that said, I want to introduce today's panelists. So today we have Kia Jones, who is the Air Quality Program Manager at Sustainable Sandhills in North Carolina. I have Julie Fulcher, who is a worker health and safety advocate at Public Citizen in Washington, D.C. And we have Autumn Locklear, who's the climate health epidemiologist with the Occupational and Environmental Epidemiology branch of North Carolina Division of Public Health. So thank you all for being here with us today. And for those of you who want to learn more about our presenters, you can download the presenter information sheet in your Handouts tab. So with that, I'm going to let Autumn get us started.
All right, good afternoon, everyone. I am Autumn Locklear, and I am the climate epidemiologist for the North Carolina Division of Public Health. And we'll go ahead and dive into my session on data. You go to the next slide, Molly. Okay, thank you. All right, so my climate health team is within the epidemiology section of the Division of Health and Human Services, or the Division of Public Health. And we're funded by the CDC's BRACE grant, which is for building resilience against climate effects. Some of the ongoing heat efforts that we have include education on heat illness, farm worker health, our heat health alert system, and we also generate weekly summer heat reports on our climate and health website. And we also partner with the community particularly Sustainable Sandhills, which he will tell you about later. Also Episcopal Farm Worker Ministries, and we have heat illness prevention specialists within our local health departments that we work closely with as well. And we go to the next slide, thank you. So in order to produce our summer heat reports, we get our surveillance data from NC DETECT, and that is where hospitals, or at least participating hospitals in North Carolina, upload their visits pertaining to, well, any syndromic surveillance data, but specifically for the purposes of this presentation, heat illness data. And so it's pretty much limited to emergency departments. There aren't really any primaries or urgent cares. There are some pilot urgent care centers, so there actually aren't any instances of heat illness data that come from urgent care centers. And when we compile that line list for the heat illness surveillance, it's grabbing events from triage notes, heat complaints, and ICD-9 or ICD-10 codes. We'll go to the next slide. So this is the 2020 summer heat report, and we get that data from May 1st through September 30th. That is our summer heat season as we define it here. And this is on our website. So to tell you a little bit more about the data, the blue line there represents the number of emergency department visits that we see from week to week. And the red line is the max heat index, which is from the state climate office, specifically at the RDU station. And the green line, that is the North Carolina average max heat index. And that data comes from the emergency department report. So it takes all of the heat index reported as it is in the emergency department area and averages that for the state. So you can see that the most visits for heat-related illness occurred on July 20th. There were 94 visits in the state of North Carolina that day pertaining to heat illness. And that maximum temperature then got up to 105. And the max heat index was 115. So pretty high day and a lot of heat illness visits to correlate with that. So we'll go to the next slide. So this is just a little bit more about our climate and health website. If you visit that link, you can find our weekly reports that we post between May and September. We have our aggregate counts for heat visits daily and weekly, and it's broken down by age and sex and also severity. So you can see how many visits pertain to heat syncope, stroke, heat exhaustion. Just get a little bit more detail there. And we also have some historical data to compare this year's heat illnesses against previous years. We'll go to the next slide. And this map shows the percentage of emergency department visits for heat-related illnesses as a percentage of the total emergency department visits. So the way that the data is reported now doesn't necessarily parse it out, rural versus urban. So one resource that we had available to kind of give you an idea of how those heat visits look in terms of a percentage of emergency department visits compared to total emergency department visits. This is like the best resource that we have right now. So you can see that there's a gradation there with the very light blue being the smallest percentage of heat-related illness emergency department visits, and then the darker blue goes up to a higher percentage of heat-related illness visits. And so this map is from 2019. 2020 wouldn't actually be a good year to report on the percentage of emergency department visits because there were fewer emergency department visits overall thanks to COVID. If people were able to handle things at home and avoid the emergency room, then they're not going to present to the emergency room. So this data is a little bit older, but you can see that there's kind of a gradation from west to east with a higher percentage of emergency department visits. So I do think that Eastern North Carolina tends to be very rural. If you're not familiar with the communities in North Carolina, for example, I'm from a very rural county, Robeson County, which is down there close to the South Carolina border with 0.242% of heat-related emergency department visits. And that applies to a lot of my neighboring counties as well. And I think that the most populous county in North Carolina is probably going to be Mecklenburg County, which is in the light blue. That's where Charlotte is. So that kind of gives you an idea of how we have some more emergency department visits for heat-related illness concentrated in the more eastern and more rural parts of the state. And we'll go to the next slide. So in terms of limitations with reporting heat illness data, especially trying to parse out rural versus urban, there are a lot of healthcare providers that do not report to NC Detect. So if someone happens to go to an urgent care center or their primary care or a federally qualified health center for a heat-related illness, it's not going to get reported in NC Detect. So there's no way that we're going to be able to report on that from our surveillance line list. We're not going to capture those visits. And it would be helpful if there was some way that we could have an idea of energy poverty, so we could tell who is struggling with being able to cool their home and avoid those heat illnesses. But unfortunately, the way that NC Detect is set up, there's no indicator of income, so we can't tell what is the result of heat illness that is due to being unable to cool their home. And not everyone who experiences a heat illness is going to seek medical attention. If they're able to treat at home, then they're going to stay at home, and it's just not going to get reported in our surveillance line list. So we'll go to the next slide. Here is some more qualitative data on what we're doing at the state in terms of heat illness interventions. So we publish reports annually from all 100 counties with near real-time emergency department data on heat illness. And we have stakeholder meetings across the state with all of 100 counties. We have public health preparedness coordinators. We coordinate with universities, nonprofits, and other community organizations to get just to communicate what we're doing and what the data looks like in terms of heat illness. And we also have our heat health alert system in some of the more rural counties, Bladen, Robeson, Scotland, and Sampson counties in particular. And we've done that for 3 summers since 2018. And we particularly focus on low-income populations, farm workers, older adults, people who need nutritional assistance, and the youth through our local heat prevention specialists or heat illness prevention specialists. And so we want to increase awareness of heat health risk and behaviors that are protected for heat effects or health effects of extreme heat. And we'll go to the next slide. All right, so that's it. That pretty much concludes my presentation. If you want to follow up with me regarding any questions, you can see my email there, autumn.locklear@dhhs.nc.gov. And I also want to acknowledge my supervisor, Lauren B., for her help in putting together this presentation and her mentorship. So you can also reach out to her as well, lauren.b@dhhs.nc.gov. And thank you for listening in today. I will pass to my next colleague.
Thanks, Autumn. Hey, Kia, I think you're on mute. So just a welcome and thank you.
Okay. Hello, everyone. My name is Kia Jones. As Molly mentioned, I am the Air Quality Manager at Sustainable Sandhills in Fayetteville, North Carolina. We're a nonprofit organization that focuses on just educating the community on waste management, pollution, air quality, water quality in the community. And of course, for this, we are a community partner with the Division of Public Health to educate the community on heat-related illnesses and how to prevent those. So next slide, Molly. So our goal as a community partner, like I said, is to educate the residents in our community on ways to stay safe during the summer months. Right now, of course, we're preparing for that time. It's already started to heat up. So we're already, like, throughout the year, we've been in contact with people, but before the heat starts, to really affect us, we want to keep those people informed. So a lot of the residents who are our focus are the ones, like Autumn mentioned, without air conditioning or not enough to cool their homes, and those who are susceptible to certain illnesses such as asthma, heart disease, and COPD, things of that nature. Next slide. So our focus areas in North Carolina are Sampson County, Robeson, Bladen, and Scotland counties. The groups that we focus on, have been focusing on, are youth athletes and their coaches. Those are the ones who are like the leaders, and children can play all day in the heat and not get it affected. So we kind of focus on the adults who lead these youth teams to kind of educate their young athletes on how to stay safe. That as well as elderly residents who may be living alone, and need someone to kind of touch base with them to make sure their homes are heated. I think Autumn mentioned that a lot of people don't report it or may not be able to report it or feel like it's not as a big of an issue to call and get educated on these things. Children, a lot of preschool teachers I've been in contact with to keep their children safe in the classroom as well. Mobile home communities, low income communities, farm workers and construction workers, or anyone who works outside as their occupation. We kind of want to focus on them and give them the information that they need. Next slide, Molly. So our efforts, before COVID, we were doing a lot of face-to-face outreach with the community, and of course COVID changed that, so we had to kind of pivot. Before COVID, we were focusing on doing a lot of community activities where we're right in the face of the people that we serve, giving them outreach materials, whether that is a pamphlet on a list of heat-related illnesses, the signs and how to prevent them, all the way up to like handing out water and fans and things to stay cool throughout the summer months. Workshops, focusing on community groups where like churches and recreation centers, where we can kind of group people together and educate them. And also like site visits, like visiting people where they are. I mentioned farm workers and construction workers, like visiting them there, handing out information, giving them water, fans, ice packs, things of that nature, so they can stay safe while on the job site. Next. And of course, like I said, community outreach in the midst of COVID, that changed. So we had to be extremely creative on how we reach the people. A lot of people may not have access to the internet or Facebook, or they're just not on it, and they may not get that information. So we had to be really creative on how we reach a lot of our community in these times. Social media, I had to kind of dig and find like neighborhood groups in the counties that we serve, and they've been helpful, because these are groups that kind of, you know, just give information within their neighborhoods, like yard sales and things of that nature. I was able to kind of connect with those people in those neighborhoods and give them that information. They were able to pass it on to their neighbors. Like low-income housing communities, just touching base with the landlords and the housing authorities in these communities, where they were able to pass on that information for us because we couldn't be there. And after like doing a lot of like Facebook neighborhood marketing, making personal connections with people who may need our services, and touching base with them every so often, building that personal connection with them. Because like I said, everyone may not have access to Facebook, but we can call them and check on them to see if they have water, if they need help with their AC unit, and things of that nature. So building almost like a friendship in the community. Connecting with other organizations, not necessarily organizations that do exactly what we do, but people who are in tune with the community, churches, restaurants who know, you know, the ones in the community, like building a relationship there with them that way, and we're able to kind of tune into the people who need our help as well. Social media campaigns were also really beneficial. We were able to get information from the Division of Public Health, like heat alerts and things of that nature, and we were able to blast it out to all these groups that I'm a part of, so everybody can kind of get a heads up on what the heat is like on that day, what the air quality is like on that day, and how to be safe. And also like email blasts, along with just meeting people along the way. We built an email list of people and phone numbers as well, where we can kind of call people and touch base one-on-one. Next slide. These are just an example of the email blasts and social media alerts that we push out. More so like right before summer, we try to really push the air quality alerts, the heat advisor alerts, and the heat related illness flyers, something we always put out there just so people can have a heads up. And next slide. And moving forward with this year, as the world kind of slowly but surely starts to open up, one of our goals as an organization is to get back in the face of the people we serve. We miss the one-on-one contact of actually handing out flyers and talking to people like that. So that is our goal this year. Safely, of course, if we're unable to do that, we'll continue to do as much social media marketing and contacting that way. Designing new outreach material that includes like the COVID. One of my main thoughts with a lot of these communities, especially people that work outside, is having to wear the mask in the heat and work all day. So we're working on designing outreach materials that kind of focus on both staying health related, heat related illness, and, you know, keeping yourself safe in the midst of COVID. And our last focus is organizing more community outreach days in these communities to kind of build an awareness. Our nonprofit is small. It's only 4 of us, and we do as much as we can to kind of get the word out, but building a community awareness is like one of the things we want to focus on for this year. So that is about it. If no one has questions, I guess we'll wait to the end. So my name again is Kia Jones. I work at Sustainable Sandhills, and my email is in at the bottom of my slide. So feel free to reach out if you have any questions. Thank you, Molly.
Thanks, Kia. Yeah, and just to reiterate, anyone who has questions, you can enter them into your question function, and we will circle back at the end. And now I want to welcome Julie Fulcher to talk a little bit about her work.
Hello, can everybody hear me? Am I on?
Yeah, I hear you.
Okay, great. Thank you. I am Julie Fulcher. I am from Public Citizen. I'm our worker health and safety advocate. And today I'm going to talk to you a little bit about what we're doing in Washington, D.C. to try to make some changes that will benefit workers in protecting them from heat stress. Next slide. None of this that's up there should be anything that's new to you. I've just sort of pulled a few of the graphics that we've used for Twitter and things like that. But just sort of indicating here that you know, we're talking about 130 million workers that are at risk of heat stress, illness, because of the kind of job that they have. And we also know that we're seeing some really horrible increases in temperature that are obviously impacting that. We know that 19 of the last 20 years have been the hottest on record. And I've just got a little bit of detail down below. This was obviously from this past August, but it marked the 428th consecutive month with temperatures that were above the 20th century average. So we're on a roll, as you could say. The other thing I just pointed out here is for us to recognize that disproportionately those who have jobs that put them at risk of heat stress illness tend to be Black and brown workers. And so it's just a racial justice issue that we should be thinking about as we think about heat stress and other kinds of worker protection issues. Next slide. So in terms of what's there to protect workers, the Occupational Safety and Health Administration, OSHA, which regulates overall what kinds of rules and standards exist to protect workers. Now, there are some state OSHAs as well. Those that don't have their own state OSHA go directly to the federal OSHA. But there are some states that, in terms of heat stress, only 3 that have created a heat stress standard, but that exists. In terms of the federal OSHA, no heat stress standard exists. What they have to rely on is called the General Duty Clause, and this is essentially the opening clause of the Occupational Safety and Health Act. That says, you have a duty as an employer to make sure there are no hazards that would cause serious injury or death. So arguably, OSHA can issue citations based on that. They have done so, but we had some bad decisions that happened from judicial review of those cases last summer that essentially said without a clear heat stress standard, OSHA couldn't issue these citations. So it's a real problem if we don't have this standard. NIOSH, which if you're not familiar with that, is the National Institute of Occupational Safety and Health. It is a subdivision of CDC, Centers for Disease Control. And they have made very clear recommendations, actually a number of times over the past 2 decades, but the most recent were in 2016, saying that we really needed a detailed heat stress standard out of OSHA. Next slide. Forgive me, take a drink in between. One of the things that we have done is we sent a petition to OSHA asking them for a federal heat stress standard. We sent this petition in 2018. We had 130 plus organizations signed on, including a few previous directors of OSHA. This is not the entire petition that you see there. It's just the first page, but you can go to our website to see the whole thing. It's rather lengthy and detailed about what we're asking for. We got a nice letter saying we received your petition. Nothing else. So they haven't made any attempt to address this. We're hoping a new administration will. Next slide. One of the things we've been trying to do to sort of force OSHA's hand on this and get them to issue a heat stress standard is to go through Congress. And what we have created is the Asunción Valdivia Heat Illness and Fatality Prevention Act. And this is a bill that would require OSHA to create the heat stress standard. Next slide. Here are our champions in Congress that have been working on this for us. In the House, Representative Judy Chu and Representative Raul Grijalva have been our primary champions. We introduced this bill last Congress, and they were the lead co-sponsors of this. In the Senate, we have Senator Sherrod Brown. Last Congress, it was Senators Kamala Harris and Sherrod Brown. We have lost Kamala Harris as a senator, but for good reason. So Senator Brown will be taking the lead as we move forward in this Congress. Next slide. In terms of what's in the bill, it does more than just say, hey, OSHA, create a heat stress standard. It goes through a lot of details about here's what you need to have in that heat stress standard at a minimum. This is just a sampling of those, but you can see, limits on how much exposure people can have to heat stress and for how long. How much hydration will be required, rest breaks, acclimatization, looking at the sort of set of hazard prevention requirements, everything from engineering controls down to, the basic kind of PPE that we work with, emergency medical response plan, lots of training, record keeping. One thing that's important here is how we compensate piece rate workers who are obviously incentivized to keep working and not take breaks. And so we need to make sure that they have paid breaks so that they will be encouraged to take them and still get, their piece rate work done too. And obviously anti-retaliation protections. Next slide. So in terms of how we're going to make this happen, one of the things that we've been doing is trying to build a coalition of organizations behind this. And we call it the National Heat Stress Network. As I said, more than 100 organizations have been involved in this issue and continue to be. We have a listserv if people are interested in getting on that. We also have a heat stress lobbying group. This is a smaller group of organizations that are able to lobby here in DC and do direct lobbying. That is, talking with members of Congress to try to get them on board. Next slide. So I just wanted to put up a few names of organizations. This is by far the short list. But here's some examples of organizations that are part of our coalition. And you'll see that we have everything from your labor and worker rights organizations to organizations working on health and also environmental organizations. And we like having that breadth of folks who are coming at this from different points of view, but all agree on what needs to be done. Next slide. So another tactic that we're trying to do to address this is grassroots engagement. And that is getting all the folks out there to get involved, talk about the issue, raise the issue, and address Congress to the extent that their organizations will allow the lobbying. And if people have questions about lobbying, you can let me know, but actually most nonprofit organizations are able to lobby. They just have to limit how much lobbying comes out of their office as compared to other things that they work on. So one of the things we do with grassroots engagement is we try to tack onto things like key dates. I've sort of listed a few here. And we do petitions that everybody signs on to, or action alerts where we ask everybody to, call their member of Congress or email them. We ask our grassroots to do letters to the editor, and we can actually provide some sort of guidance on how to do that. And we try to do Facebook Live events, those kinds of things. Next slide. Obviously, one of the pieces of the puzzle here is social media. If you're not familiar with us, our handle is @SafeWorkers. You can see it, I think, listed on one of these pictures. And we do things like Twitter storms and try to get everybody involved. We also regularly, on a daily basis, tweet out of that. So if you want to get on, you can sort of see what's going on. That handle actually covers more broadly worker safety issues. So not everything on it is heat stress, but heat stress is definitely a big portion of it. Next slide. I apologize. I took allergy medication before it got on, so very thirsty. We also obviously try to do media outreach, and media outreach is more than just, media is interested, so they call us and they ask us for a quote, or they do the same to you in your, your local areas, or if you're national, they do the same to you. What we also try to do is media outreach, and that is try to develop relationships with publications and with specific kinds of journalists who may be interested in the topic or who've written about it before, editorial boards at newspapers, whatever we can do to sort of get them interested in the issue and raise it and get them involved in trying to write something about it. Obviously, we do press releases and things like that and encourage others to do so. Next slide. So the question, what can you do to advocate for worker protections? Here, just a few examples here. Obviously, you can join our heat stress network and, work with us on lobbying. We're not really active on the legislation side right now because we have a bill that's already written, but we will continue and do things. So if you're interested in that aspect of it, definitely join us. We ask people to start state and local campaigns around heat stress so that they can really raise the issue and also incorporate into their talking points what we're trying to do at the federal level. We encourage you to do things like district meetings in support of the bills. What happens back in the districts for Congress people is very important to how they address the issue, and they need to know that folks in their district care about it. So if you can do some sort of event, that's very, very helpful. We often will organize support letters for the bill. We ask you to do the same within your local community, for example. You might want to do that. We ask you to share your heat experience as much as possible. Share that with our listserv, share it with any kind of press contacts that you have, share it with all your coalition partners. The most powerful thing you can do to get a member of Congress to care about the subject and to support the bill is those intimate stories of individual people who have experienced heat stress illness or who have lost their lives to heat hazards at work. So getting folks to come forward and share their story is really helpful. Next slide. So that's all I'm covering for the moment. I'm obviously available to answer questions. You will see here that I've included my email address on this slide, so you're welcome to email me, and if you're interested in being involved in the Heat Stress Network, I can add you on, so send me an email about that. And thank you.
Thank you, Julie. And yeah, I'd love to welcome the other panelists back for a little Q&A. You guys were very efficient with your time, so we have plenty of time to get to audience questions. So once again, if you do have a question, submit it through the questions function. And Julie, you actually already answered the first question that came up a few times, which is how do people join the National Heat Stress Network? So the best way would be to email you directly.
That's correct.
Okay, so I will also enter your email back into the chat for people. And then I guess while we still are on the topic of your work, Julie, we had a question about a little bit more detail on the heat stress bill. And does the bill suggest developing particular maximum degree and time thresholds for different occupation and work site types?
Yes. Essentially, it follows the NIOSH guidelines that I mentioned, which lay out in great detail, probably more than anybody ever wants to know, but they have sort of a lengthy PDF on the website that goes through all of this and is very clear on sort of how much time you can spend when the heat is at certain levels, and obviously they incorporate things like humidity into that, and airflow and all those kinds of things in order to calculate that sort of limit. But you have the time limits. In some cases, you're not going to be able to do work more than 15 minutes at a time without a break. Other times it'll be longer, really, depending on the situation. And it also talks about, how those breaks should occur, how long they should be, your access to hydration. And if you didn't already know, you're supposed to be drinking a lot more water than you ever thought you were gonna. And that's true in life, but it's very true in terms of heat stress and protection. And it talks about, shaded breaks and cooler rooms and that kind of stuff. So it goes into a great deal about that.
Great, thank you. My next question is for Kia, and I was hoping that you'd be able to talk a little bit more about how you got connected with the Division of Public Health and kind of elaborate on the relationship there. Do they give you funding? Do you just stay in touch frequently? How does that work?
My position, well, I've been in my position for about a year now, and I think we do get a contract through them, and they give us constant support, constant information. We touch base monthly about any concerns they could help us with, and they always give us information about any additional funding in North Carolina that we can apply for to kind of push our vision further. So yeah, it is a contract. It pays me to do what I do in this position. I hope that answers the question. I didn't want to get too deep into it because I don't know what happened before.
Yeah, no, I think that's helpful. And then Autumn, you talked a little bit about like the limitations of the data that you have to analyze heat-related illness. So I wonder if there's any things you could identify that would be helpful in terms of collecting data that's not there right now that could be helpful for future analysis of heat-related illness.
I think we would need to get more providers to participate in NC Detect so that they would be able to report on that, and or at least connected with institutions that do report on that, if they're able to forward that to someone else who can report to the state, that would be helpful. And yeah, I think it's a matter of organization, really. It's not something that we would be able to change here at the state by ourselves.
And then I guess to follow up, similar to that, sorry, I gotta scroll up and find it. You talked about energy poverty data, and somebody asked, is that data accessible from community action agencies who normally administer LIHEAP? I'm not sure if you know that acronym. I don't. Okay. I guess, okay, if that's too hard a question, another thing is, how is emergency department defined in your data?
It's defined by the list of participating hospitals. So on the NC Detect website, I think I might have included the link earlier in the presentation, but there is a list on the NC Detect website that shows the participating hospitals, and there are 126 institutions or practices, hospitals that are participating with NC Detect right now. So the data is pretty much just limited to those organizations in particular.
Thank you. I will circle back to Julie. So I'm not sure how much detail you want to go into on this question, but somebody did want to know a little bit more about the case where someone tried to enforce the heat stress standard and it was rejected, and if you could elaborate on why that might have happened, and why there's kind of resistance to OSHA enforcing this kind of thing.
Sure. It was actually a set of 3 cases that were combined into one, or 3 citations that were issued that were combined into one. They were all against the United States Postal Service, and all of the cases involved heat above 105 degrees. And all of the cases involved individual letter carriers who were became ill enough to go to the hospital. They appealed these. There is an administrative court where you can appeal these cases. What they were arguing was essentially that there wasn't a sufficient standard in place to require them to do anything about it. There was nothing that OSHA put out that says, you have to do this or you can't do that. And so the judge was actually very sympathetic to the issue. And she was very clear many times over saying that this wasn't saying that this kind of heat hazard didn't exist. It wasn't saying that this was not excessive heat. Essentially, what they were saying was what OSHA has in place is insufficient. And what OSHA has in place are very simple guidelines that use the heat stress index chart that I'm sure everybody's seen. I'm sorry, I don't have a slide on it, but it's a chart that looks at temperature and humidity combined and sort of gives you kind of what it really feels like outside given a certain temperature and a certain humidity. And the chart is broken down. Usually it's color coded by sort of what's dangerous levels of heat. And it also says that having prolonged exposure to these heat levels are dangerous. And what they said was there was not sufficient evidence that that chart was developed by people with expertise in heat stress effects on workers. It was actually developed, I believe, by some meteorologists. And so, there wasn't sufficient scientific background. There wasn't a sufficient definition of what prolonged activity or strenuous activity meant. And so what the court said was that's not enough, that you have to have, something that is clearly based on science and that clearly defines, the issues so that an employer knows what they can and can't do. So all of those citations were overturned. But as I said, the decisions that this judge put out, and it was like identical decisions in every case practically, said over and over, this is not saying there wasn't excessive heat here, or that this wasn't a dangerous heat level for these folks. It's simply saying that what OSHA needs to do is develop a heat stress standard. So in many ways, what happened was very helpful to us because, the judge was saying, you need to do this, OSHA. You need to develop a heat stress standard. So, we're using that as part of our advocacy to show that, in fact, this is really crucial, that we can't just rely on the general duty clause to make this happen. So, that's our added piece of evidence that we now provide as to why this is not only important, but critical to address, since we don't really have an easy way to have these cases upheld.
Thank you.
One thing I will just add, because I think it's important to know, the citations were issued in 2016, I think, 2015, and they weren't heard before the court until last year. And the Department of Labor made no attempt to essentially support the existing heat stress index chart. They made no attempt to talk about how it really is valid or important or useful. They literally did not answer the question. And they were asked very specifically what temperature range would constitute excessive heat, and they refused to answer. So we didn't have a lot of argument going for us in that court. But luckily we still had a judge who knew her stuff and talked about how important it was for them to address it. And we have hopefully a better administration in place that not only will, vigorously defend any kind of citation they do issue, but hopefully will also now do a heat stress standard.
Thank you. Kia, the next question I have is for you. We have a little time for a few more. So, so this comes from an attendee, and I'll just read the entire thing because it's a good story. So, my community in northern Colorado has not historically experienced what qualifies as high heat days based off the heat stress index. This doesn't mean we won't face risks to high-risk populations, especially in the shoulder season. What advice do you have to helping messaging or do outreach to the high-risk populations who are just beginning to face heat-related challenges?
I know that's hard because I think I mentioned before how people, they don't think it's an issue to it's an issue, or they won't thinking that, it won't affect me, or what I'm experiencing in the heat will pass. Is basically, like I said, like revisiting the message over and over and over, showing them data like Autumn showed us, and showing them like the physical effects of the heat. I know if they haven't experienced it before, it's like it's not at the forefront of their mind. But it is something, I would say, just like a climate like what's going on in Texas, they didn't really prepare for, weather like that. It doesn't mean that it's never going to happen. So it's like, it's something that you just have to kind of reiterate with the communities over and over. And like I said, just find creative ways to kind of relay that message. Like the elderly community receives the message a lot different than the youth, so it's like you have to kind of tailor your message and customize it to different communities. I don't know if that answered it, but yeah.
I think so. Okay, my last question will go to each of you, so you can kind of add your own lens to it. So what are examples of resilience indicators, or I guess I would rephrase that to like measurements of success to determine the effectiveness of your heat interventions or success of your efforts particularly in rural communities?
I guess I'll answer. I guess for us, because we partner with the Division of Public Health, like seeing that data, and also like as our community grows within face-to-face interactions, I guess for me, I can measure the success of our programs and workshop to see how far our message is growing in the community, and comparing it to the Autumn, the data that Autumn and Lauren has.
Right, and just to piggyback off that, I think we would want to see a decline in the percentage of emergency department visits for heat-related illness as compared to overall emergency department visits. We want to be able to see a decline in that compared to the historical percentage of emergency department visits.
I would just sort of add that, we need to recognize that things like agriculture are particularly at risk of heat stress illness. In fact, agriculture by far is like 20 times more individuals end up with, serious heat illness or fatalities. And obviously that's, rural communities that we're generally dealing with. It's also very often an immigrant population, many of them undocumented. And so, part of the problem is they are not getting adequate care, and they really can't sort of argue back with their employer because, their jobs are on the line. And so, a success there would be able to make sure that we have employers in the agriculture industry who are paying attention to this and are developing systems that are very responsive to what's happening to the employees. We have to go farther than just, here's the standard that you should set, but also making sure that individuals who are experiencing any signs of heat illness do receive immediate care, including having some sort of emergency response on site, and also transportation to a hospital. So those things need to be in place in these agricultural rural situations.
Thank you. Thanks to all three of our panelists today for your insight. And yeah, I will make sure to send out your contact information with the presenter information with the recording for this, since each of you have offered that. But I think we will wrap up for today. So I want to just say thank you to the audience for joining us and for the great discussion today. And I hope you can make it back to the final session for the Heat Stress series on March 10th, and it will focus on species and ecosystems, so have a little bit more of a natural resource lens to it. And like I just said, we'll be sending out the recording of this presentation to you all early next week. So feel free to point to your colleagues who couldn't be here to find the session posted on the Climate Adaptation Knowledge Exchange And in addition to webinar recordings, you can also find hundreds of other resources related to heat and climate change on the Climate Adaptation Knowledge Exchange. And so also after today's session, I invite you to join virtual discussions with our online networks on social media. And throughout the rest of the forum, I'll be posting information on the series there as well. And I look forward to hearing from all of you about your experience at today's session in our post-webinar survey. But on behalf of EcoAdapt and myself, I hope that you all have a great rest of the day. And once again, thank you to our panelists. Any final thoughts from our panelists?
We're good.
We just hope that everybody gets involved in the issue as much as possible. You're here, so obviously you care about it. And I think it's a matter of, doing what you can to make a difference.
Wonderful. Great note to edit on. All right. Thank you all, and I hope you have a good rest of the day.